Hello. Oh, I'm sorry. Today was a terrible day for mascara. I didn't think that out. My name is Maureen, but I prefer to be called Mo. We went over that. I'm from West Virginia, and I thought I had a really good speech prepared about caregiving and what happens to you, and then Tony hit me with her stuff. Miss Paula got up here. I needed a new game plan, but a really wise person told me that if you can't love yourself, how the hell are you gonna love somebody else? The prophet RuPaul Charles, I mean. That is the best advice ever. It's true, it's right? So, and it took me a really long time to accept the fact that that's a thing. You cannot take care of people if you're hurting yourself. When I was in high school, this book came out called All I Really Need to Know I Learned in Kindergarten. And like the condensed version, it was like that chicken soup phenomenon, like people had posters of it and copies of a really long book, but the condensed version was like these 16 bullet pointed, like very simple rules about how to live life. Stuff like share everything. That's good, solid advice. Play fair. Don't hit people. And I was thinking about that book in terms of healthcare, chronic illness, things like that, like cancer. It's the great equalizer, right? It hits everybody. It does not play fair. Another one of those rules is clean up your own mess. Well, cancer comes in like a whirlwind, and you're lucky if you can get up to clean up that mess. So advocacy is really important, but at the same time, we have to take care of ourselves too. And I know, I could tell, the hardest thing for people in this room in particular to talk about is their own pain, because there are other people that need you, right? Another one of these rules is wash your hands before you eat, flush the toilet, and warm cookies and cold milk are good. I'm not gonna touch those. Those are good on their own. I'll leave those alone. Live a balanced life. Sometimes illness doesn't allow you to do that. You're lucky if you can make it through the day. Take a nap every afternoon. I have a 5-year-old. That's not possible. When you go out in the world, watch for traffic, hold hands, stick together. Life is inherently dangerous, right? Illness makes it even more so. And it really doesn't matter how old you are, it will come at you whenever it wants to, no matter who's holding your hand. Be aware of wonder. That one took me a minute also. I was about 37 when I woke up to that. The fact that I was waking up in the morning was amazing to me. I was really sick, and I ignored it for a really long time because my brother died. My sister had a brain tumor. My daughter was diagnosed with epilepsy. And I could still walk and talk and cook and clean, so I was still useful to my family, so I ignored lots of things. But when we're talking about healthcare legislation and policy and bringing a voice to advocacy, as far as having a dialogue with legislators, the last rule on this list says, remember the Dick and Jane books and the first word you learned, the biggest word of all, look, right? I would urge our congressional leaders to actually do that because they hear a lot, right? But what they really need to do is look. Because sometimes the warriors are the wounded. Thank you.